I'm Ebonie Rio. I'm a sports physiotherapist. I work at the Victorian Institute of Sport, and I also hold a joint position between the Australian Ballet and the Trobe University. So I split my time between being a clinician and a researcher. Tendons make us achieve amazing things. You know, we need them throughout our whole life to really optimise movement, to reduce the cost of locomotion, but you know, for all of our athletic pursuits. And we know that physical activity is critical for health promotion, and tendons are a really important part of us being able to maintain our physical capacity as we get older, as well as, you know, appreciating the incredible things that athletes do. So I think tendons should feature in people's kind of, you know, top 3 tissue passions. I think one of the biggest challenges is differential diagnosis, particularly picking, you know, a tendinopathy versus the peritendon, or when you have a mixed presentation, you know, the bursa. So I think we ask a lot of physios in terms of being across a lot of different musculoskeletal conditions, but also then having the ability to zone in and be really specific. So I think differential diagnosis is the first and most important one, because if you don't get that right, you can really end up on the wrong path. So the 4 types of tendon injuries are tendinopathy, so pain and dysfunction of the tendon, peritendon condition, so that's where the outside synovial sheaths slide and glide, and that overload presents differently to tendinopathy. The third one involves the bursa, and the bursa can be part of that enthesis or it can be completely separate. And then the last one relates to rupture. So each of those 4 different types actually present a bit differently and need a different management. So if you constantly think of your tendons, most of our lower limb tendons are springs, and if you think of them as springs, then I think you're inherently motivated to teach people to be springy. And you know, I was asked a question straight after the presentation, should we be getting our older people to do spring activity? Absolutely. We want them to still be able to go up and down stairs, which involves using your springs. So if you think like a spring, you won't just stop at strength training, you'll actually progress people back to function. You know, we talk about exercise being the cornerstone, but advice and education has to underpin that, because if people understand what loads provoke them, what loads they're really safe to do, when to listen to their tendon, that advice empowers the patient and the athlete to manage themselves, and the physio supports them in that, but the person's really at the centre of driving their own rehabilitation and progression. So I think language is critical, and we see that across a number of different examples. And you know, I talk a lot about the systematic review where they manipulated language, but it's a reminder that the words we use underpin people's understanding of their condition, and more importantly, what they think they need to do about it. So language becomes really important, because if I say to you, you have tendinitis, but I'm going to give you a really good exercise program, there's a mismatch between someone's understanding of what they think they need to do and what you're offering. So even if you think, you know, it's just a word, it's actually a really important fundamental concept for people to then, you know, buy into exercise being really important.